Hi, so today I'm going to be performing my clinical examination. I'm just going to go I'm just going to go through the guideline and answer all the questions. So first up, animal's name or number. This little guy is actually a kitten that was surrendered to us. He was found up under a house and he's from a litter of 12. So he's little boy number 7. That's what we call him. And he's a domestic short hair cross with a Rex. So if you can see the curly fur and the big ears there. Colour is brown tabby. Weight is actually a very good question. I'm gonna go get that. Okay, so his weight is 1.554. His age is approximately a month and a half. He's still very tiny. And he is a little boy, undersexed. He hasn't been vaccinated yet, but when he is, he'll be going home on an F4. But he hasn't found a home yet, so we don't know when that's going to be. And he hasn't been wormed yet either. The kittens are actually still with their mums, so they are, I suppose, relying, although we don't have very reliable sources about their vaccinations. So he was a stray, and he's got a very good temperament. He's got a very good temperament. He's very nice, and he's very interested in things. And he's very affectionate. Okay. Distant respiratory rate. Seems okay. I can't hear anything, and it doesn't look as though he's breathing too rapidly. And I'd say his body score index is probably average, although we do expect a bit of fat on the kittens. That and the fact that he's part Rex, I guess, are naturally thinner cats. I suppose if you looked at some of his brothers and sisters, they might be a little bit pudgy. But I'm going to go with average. It's hard to tell with kitty proportions. General appearance. I'd say he's pretty handsome. I think he agrees. Behaviour. Yeah, there's nothing aggressive. There's nothing that really stands out. He does get a bit afraid sometimes when he's in different environments, but I suppose that's normal. Skin. He doesn't, well, actually, he smells like a room full of cats, but it's nothing to be particularly worried about. He's not experiencing any fur loss, just the regular. He's quite thin around the ears, but again, that is a Rex property. He doesn't have any wounds, and he doesn't seem itchy. I haven't seen him scratching at all. I haven't seen him excessively licking. Okay. And his movement, it's quite good. We often get him out and just leave him on the desk. Oh, he'll do a demonstration for you. It's normal anyway. So his mental state, I'd say he's quite active. He's interested in his surroundings. When he is, when he's with his brothers and sisters, he's quite playful. It's hard to tell with kittens this young, obviously, because their personality doesn't come through until they're a couple of months old, but yeah, he doesn't seem to be in any pain, and he's certainly not avoiding any activity. He makes his way to the food bowl just as well as everybody else. And speaking of which, yep, he does have a normal appetite for a kitten. It is a bit hard to tell individually because he does stay in a room with 7 other cats. See? But yeah, I'd say it's quite normal. And feces consistency, I can tell you, is firm but not too firm. It's not dry and it's not too wet either. They get a mix of wet and dry food. Some of the other kittens actually noticed a bit of bleeding but not in the litter where he's staying, so hopefully that means his functions are normal. And urinary output, I'd say the same thing, I suppose. There are no abnormal odours, but this little guy, he's actually been treated. In his, it's hard to even tell now, left eye I think it was, there was a bit of a discharge and it was really squinty. Some mornings we'd go in and we'd find him with it almost gummed shut, so what we'd do is basically wet a swab with warm water and just sort of gently wipe the discharge away until we started using the Amazon eye ointment to actually treat the cause of the problem. And as you can see, there's not really a trace of anything left. Okay, so I guess I've got to start taking rates. So his heart rate is actually like 200. He's probably obviously stressed because he's away from his mum and from his brothers and sisters. But it's also obviously normal for smaller animals and kittens to have higher heart rates than fully grown cats. So his respiration rate, I was actually having trouble hearing it then, but I'll have another go. Stay there, buddy. Okay, I can't actually hear it over the sound of his heart beating and his meowing. So I'm just going to rely on watching his belly here. So I'd say it's probably around 80 or 90. I'm sorry. I'm sorry that I don't have a better patient. Okay, mucous membrane. Let's go here. Come on. He's so tiny it's hard to tell. It's pink. And about 2 seconds for the capillary refill time. Femoral pulse. I imagine this is going to be quite difficult to take. So I basically got about 12 beats in 5 seconds, and I had to do a voiceover here because I realised I did some very stupid maths. So 12 times 12 is a rate of 144. Right, let's just move on from femoral pulse. Okay, I might actually leave the rectal temperature to the end, because I don't think he's ever had anything this big near his bum before. So I'll check his hydration. Pinch the skin. It's got good return. It's less than a second, so yeah, he's pretty well hydrated. His eyes, well, as I mentioned before, he originally had that discharge, but otherwise they're nice and clear. He doesn't squint or anything that I can't see just from a distant exam any corneal ulceration or anything like that, so that's good. He doesn't seem to be in pain anymore, and there's no more, well, he didn't seem to be in pain in the first place actually, but there's no more discharge. He's certainly not troubled by his eyes anymore. So his ears, actually, his big Rexy ears, have a bit of, if you can see it in there, wax in them that's quite dark. Actually, we've noticed in these kittens that the domestics have clean ears, whereas these Rexes with the big ears have a little bit of black muck in there. So that might be something we have to look into further. I'll just make a note of that. Blackish wax. So that might call for, yeah, just a swab inside and a bit of a look under the microscope. But you'd think if it was a problem with mites that it would have spread throughout the litter, which we haven't noticed. So it's probably just natural production, maybe just that the Rexes do it excessively because they don't have maybe that hair protecting the inner ear canal. The mouth. Okay, he's got a perfect little mouth because he's just a tiny kitten. Yep, come on. Lovely white teeth. Absolutely no sign of dental disease whatsoever, and the teeth are all coming through nicely as well. Come here. They all look about in the right place. Feet, pads, nails, and limbs. It was actually mentioned by one of the vets that he has quite long foretoes, but otherwise healthy. There's no discoloration of the nail or anything like that. It's not at all difficult to excise the nails from the pad. Yes, I know. And quite normal pads as well. Oh, he's loving this. No sign of any damage or anything like that. Abdominal palpation. He's not yelping or anything like that. There's no sign of pain. He's just got a bit of a kitten belly. He's quite firm, but there are no unusual lumps. I'll actually, we can do a comparative shot of him and some of his siblings just to add to it. He's quite normal. A couple of them have hernias. One other little guy had a dischargy eye, but other than that, mostly healthy. Genitals, come here, buddy. Yep, they're tiny, but they're there. And 2 testicles as far as I can tell. No sign of abnormality, and I believe they're functioning quite well as well. And anal area. This is a pleasant shot. Nothing remarkable about it. It's not particularly red. It's not particularly dirty or anything that would suggest a lack of interest in grooming or a loss of sense of self-preservation that comes with sickness. So that's pretty good, huh? I guess we just have to do the thermometer now. Sorry, honestly. Looking back on these things is honestly the most painful. Yeah, hi. I know. So we'll give him a bit of lube and hopefully this will go smoothly. He won't trust me again after this. Will ya? So just holding it adjacent to the anal stay. Oh, he's glorying me in the back. Yep, come on, babe. Yep. Alright. 37.6, which is actually, might be a little low. Okay, just make note of that. Otherwise, we've got a healthy kitten here. He's a good looking little boy. He's very cooperative and I'm very grateful. I'll scan the results that I've recorded on the sheet and attach that to the same email I email the link of this video to. And hopefully that'll be sufficient. Alright, we'll go back now.